Morning, Lori. Good morning, Allison.
Good morning.
Morning.
Happy Monday.
Good morning, all.
Hi, Leah. Allison, thanks for joining us this morning for the special ed team.
Oh, no problem. I'll do the best I can and I'll take back any questions that I'm not sure of. How's that?
That's awesome.
Pizza party and receiving the highest in the school. And finally.
Also, just so that you know, I'm going to keep my camera off because I will actually end up in a classroom in about a half hour.
With determination and hard work, and we hope.
Good morning, everybody.
Good morning, Pastor AJ.
Morning.
Everybody all right? Yeah,
Morning.
outstanding. We're going to start in just a moment. Just want to make sure folks come on. Christina, was there anybody who said they were not going to be here?
Nope, I have not heard that anybody's not going to be here. Let me just double check the invite because sometimes they
Good morning, everyone.
decline. Morning.
Good morning.
Oh, Kim did decline the invite, Miss Oliver. So I will assume the rest have accepted or no reply. And there's Jahai, Miss Escribano.
You can call me Jahira.
Just trying to be consistent.
No, I understand. I give you permission to call me Jahira.
Right. Likewise with Christina, it's fine. And Dr. Schmerling put tentative, so I'm not sure if he'll be able to join.
All right. Do you mind sending out a quick text message just reminding folks just really quickly? Because in the next minute, I'm going to go ahead and get started so we can have some good time value today on this wonderful, chilly Monday morning. Good morning, Tyrone.
Hi. If I can say one thing, Christina, good morning.
Good morning.
The one thing I was trying to touch base with you at the last meeting is for one of our committee meetings, I think it might have been this one, Richard DeMay was mentioned as an attendee. And it was actually just me because I share an account occasionally when it gets logged on, his name will appear and then I update it. So I just wanted to share that because I think I wanted to make that modification on one of the attendees list, one of the committee meetings.
Okay. I'll
His name
double
was
check.
there just kind of erroneously just because of the account sharing.
On the minutes you're talking?
Yeah, it was on the minutes. It's a minor thing.
No.
My name was on there too, but I figured just to be correct, and
Okay.
I'll point out to you. I saw it for last month's,
Okay. By now I know, and I recognize as soon as I see that name, I know.
That's
it's
why I
you,
was going to just,
Yeah.
next time we talk, we're going to share it to you.
But
Okay.
thank you for pointing that out.
Yeah, Tyrone, my mom has attended many meetings due to our shared account.
Yeah.
Dr. Celeste Johnson has been
Okay.
part of
I
many
got
meetings.
you. I got
All
you.
right, so I got my squad with me, and we are here. So we're gonna go ahead and get started. I just want to say good morning to everyone. I hope everyone has had a fantastic weekend with your families and all the different things that you have done. It is Monday morning, so I just want to just allow this opportunity for you all just to what do you call it? Stretch a little bit, get loose. I don't expect this meeting to be long at all. I want to give a shout out to Dr. Silver and Christina for providing me some amazing notes for our last meeting, as we had the first of many committee reports on our agenda that I've seen since I've been on the board. So I just want to thank you all for those notes that were very detailed and very short and to the point. And thank you. And so with that being said, I believe we only have maybe 4 agenda items that we're looking at, maybe 5, but I don't see this being a long meeting because I believe we have a second reading for one piece and just some check-ins on the other. So with that being said, I'm going to turn this over to Dr. Silver to lead us and take us further.
Thank you so much, Reverend Johnson, and good morning, everyone. I am going to start by sharing my screen and bringing us to our slide deck that we have for this morning. Everybody over there. Okay. We have second readings for 4 policies, and we have 3 first readings, and all of the materials were sent to our board members so that you could pre-read them, take a look at them in advance. I do want to say this is a record-setting year for our policy work, and I really appreciate how much people have leaned in to bring our policy manual up to date, up to speed, and in compliance with statutes and Connecticut laws. So thank you so much for all of your work. Our first policy for our second reading is student discipline for drugs, tobacco, and alcohol. And we are required to have prescribed rules for management and discipline in our schools. And the primary revision, again, this is probably review for everyone, is an update to legal references regarding cannabis use. And I'm going to go to the policy. Oh, I was at the bottom reviewing it before we started. So this policy was recodified in October, and the old policy number was 5137, and the new policy number is 5131.6. And since you've already seen this a couple times, you'll note the red line here is the revision of the policy number. There is one change here where this comes in alignment with our policy and our practice. The administrator will will follow the board student discipline policy. That is the change from recommending a student for expulsion for this potential disciplinary issue. So possessing a controlled substance will transition to following the board student discipline policy, which we've already looked at that. And then the legal references were all updated, and that is the red line here. So let me pause and ask if there are any questions about this policy.
No.
No questions?
Any questions? I believe Tyrone said no.
No.
Jahira? I'll
Sorry, I
take
was
that
on
up.
mute. No questions. Sorry about that.
Okay, all right. Yep, all set.
All right, great. We will go back to our agenda then. That is our first policy for second reading. And Pastor AJ, if we may move that policy for a second reading to the board. I will go on to the next policy.
Yes, proceed.
Okay, thank you. Administering medication, and Ms. Comedies is here with us today. The purpose of this policy is for the Board of Education to determine who shall administer medications in a school and the circumstances under which self-administration of medication by students shall be permitted. So this policy underwent just a tremendous amount of work. And again, this is the second reading for you. And you have copies of this, but you can see that there's quite substantial updates to this policy. And I'm going quickly, but if there's any time that you want me to pause, please let me know. But I understand this is the second policy. So we added quite a number of definitions. And again, I'm very appreciative to Dr. McGilpin and to Ms. Comedies for all of these updates to this policy. This policy has 29 pages. And I don't want to give anyone whiplash, but we did update quite a bit to bring it into alignment with our legislative mandates. Yes, it was last revised, updated in 2005. So this is great work. And then our regulations follow. And I know everyone has received a copy of this. So I don't want to give anyone a headache by scrolling too quickly across all of this text. But you do have copies of this. So Pastor AJ, if I may, oh, Mr. Walker, do you have any questions?
Yeah, just, I mean, because it's such a massive rewrite, I know it's the second read, but is there kind of an executive summary in terms of like what's the actual central change here that we're paying attention to? Obviously, I see there's a whole lot of redefining roles and what people can and can't do. I mean, is that the main takeaway, is just redefining what the individuals can do in terms of defining all the different players and what element and what role they play? Is that kind of the takeaway here?
Ms. Comedies, can you offer an overview?
Sure. Yes, thank you. So a lot of the rewrite does have to do with the definitions of different people who can be trained to administer medication. It is a long policy, so forgive me if I'm missing anything here. It talks about having stock EpiPens at each school to administer in the event that somebody has an anaphylactic or a serious allergic reaction. It qualifies who can be trained to administer medications. It talks about training aftercare, before and aftercare staff in administering medication. There are some parameters about doctors' authorization to administer meds. Goodness, those are some of the biggies.
Right. Okay, I see what you're saying. I think that okay, so I'm trying to put in my head a takeaway. So because I didn't live with the policy before, being a new board member, so I think the takeaway that I'm getting is this policy is being modified just to better align with the current state understanding and directives in this area. Because I'm assuming the prior policy had the same kind of layout in terms of who does what and when and under what direction and training. Okay, so this is just an update so we align with the state.
That's correct.
Okay, all right. Okay, I got you. All right, thank you.
Thank you for that question, Mr. Walker. I also want to emphasize, and I know Ms. Comedies mentioned this, but the policy really expands the opportunity to use the epinephrine, the EpiPens. That's really a big part of this, and so that it expands the roles of people who can help children who are having anaphylactic reaction, and also, under medical advice and medical guidance, if a child is having an anaphylactic reaction, we can provide epinephrine to that child. So in the past, if a child had never had an anaphylactic reaction, we would not be able to provide the EpiPen treatment, but now we can keep them in stock, and we can support a child who has a new anaphylactic reaction.
Okay. Yeah, thank you. That's actually an important to understand. And again, I'm assuming it's aligned with the best medical insight that now we understand that it does less harm to actually provide it versus not provide it.
That's correct. Yes.
Right. Yep. Thanks.
Thank you for your question. If there are no other questions, we'll go on to our third policy for the second reading, which is food allergies. And this is a focus on prevention, education, awareness. And this was last revised in 2006. So it does bring us up to speed with, again, similar to administering medication, the food allergy management plan is a plan that the changes here have broader application. And Ms. Communities, can you offer a summary of this as well?
Yeah, it really I think the gist of this is really bringing it up to date with state regulations and also formalizing the process whereby the nurses work with food and nutrition services to make sure that students with life-threatening food allergies don't come into harm's way. Really provides for a process so that departments can communicate, so that children, so that everybody is aware of a child with a serious food allergy in school.
Thank you. We can see, again, to your point, Mr. Walker, this does align with the Connecticut Department of Health and Department of Education for students with life-threatening food allergies. And there is quite a bit of, there's a typo here. There we go. There are quite a few changes in terms of the legal references, updates to that information. So are there any additional questions about the food allergies second reading of this policy?
No.
No questions on my end. Thank you.
Okay, great. We will go on to the next policy. This policy is instruction about the harmful effects of substances and speaks to the support of teachers in helping children understand the harmful effects of drugs, tobacco, nicotine, and alcohol. We did check with the Connecticut Association for Boards of Education, and we can, because the word citizenship was intended for the, was intended to link to the process of receiving a free public education as a support toward having an educated citizenry. The word citizenship actually appears in the legal statute in reference to performing civic duties, such as the work that all of our board members do in their volunteer service. So what we've done is we have included the word social responsibility because that was the goal of our board. The spirit of the message that we had crafted, our board members had crafted, was around social responsibility, which was related to citizenship. So we have included the term there, but we're advised by the CABE attorney not to remove the word citizenship because it is in the statute. So that was the revision that we had, aside from the language that was provided by CABE for the policy itself from their core policy manual. Are there any questions?
Through you, Mr. Chair.
I'm happy. Well, obviously, I wish the citizenship wasn't there, but I understand by statute. But I appreciate you guys getting the feeling of all of us and including social responsibility. So I appreciate you guys still including that there. So thank you.
Yeah, thank you for that update. That's something that was obviously important to me and important to Hira. As we look at the landscape of what, where we are in this country, right? So appreciate it.
Awesome. Thank you very much. I think it was an astute call, very sensitive and thoughtful and necessary. So hopefully, I think this will do a great job meeting our community's needs and send a message about who we are as a community. So that concludes the portion about for the second readings. And we are ready to head into our first reading. We have special education program, preschool special ed program, and exemption from instruction. These three policies are mandated policies, and the special education and preschool special education program, we actually had integrated this language into our another policy on our programs. And it is a mandated policy that we have a separate policy for special education. So I want to just extend my appreciation to members of our team that have worked on this. I know that Ms. Ward is here with us this morning, but also Ms. Hoffman and Dr. Negron, Jennifer Hoffman and Dr. Negron have been key in crafting these special education and preschool special education program policies. So just an overview, which you may have seen if you already received the slides. But it speaks to our commitment to including students with special needs. And the policy number is in the header, so I'll just share that with you. It is 6171. And this is, for the most part, boilerplate or core policy manual language from CABE, which has been vetted by attorneys and crafted to align with the statutes, Connecticut statutes and legislation. So we did add an introductory piece to this. Giving you a minute to read that. And I don't know if this is large enough. I will make it a little bit larger. Oops. There we go. And I'm going to scroll down now that you've had a look at the introduction. And it's not a long policy. Just a page, but it's really essential to our work. References to other policies, as well as legal references here. And so I'm going to scroll back up to the top of the policy and through you, Pastor AJ, our chair. Are there any questions or refinements that we'd like to make to the language here?
Yeah, I have a general question for Attorney Masrick as it pertains to our special education. I am interested, right, because I'm in the community. When I go around, there's a lot of people reaching out to me regarding IEPs and how dissatisfied they are with it. And I'm not sure if these two connect, but what I am interested in knowing is potentially how many lawsuits a year do we have pertaining to our special education? Is it regarding our policy? Is it regarding our implementation? Is it regarding just staff not navigating well? I just need to know if there's a correlation between the two of where we are in terms of our policy and potential in previous lawsuits.
Good morning. Reverend Johnson, I could check that data for you. I don't know offhand. I can't tell you sitting here right now how many, litigation cases we might have regarding special education work. I could certainly get that data for you. I don't know if Director Ward has any insight on things she might see in the day-to-day work that she does.
Yeah, so I can't either obviously tell you the exact number, but we could definitely look into that with Jen. As far as whether it's this policy that we're being sued over, I would say no. I think it's more of the implementation practices than this, honestly.
I guess I have a question. I guess I'll direct it through the chair as well.
Yes, sir. Go ahead, Brother Walker.
Yeah, it's a follow-up to around IEP. More of a general question, and so the policy. I mean, I don't have an issue with the policy as is presented right here. It's very high level, and who's going to disagree with this commitment? But my question is IEP and as a follow on kind of the PPT process, are those the vehicles, the primary vehicles we use to assess the needs of students, at a special needs or level? So I'm saying, yeah, that's my question. Based on this policy, is IEPs and the PPT process the main way that we kind of breathe life into this in terms of actual student engaging with school?
I think Ms. Ward might be the best person to respond to that.
I would say yes, that is, the PPT process as far as, starting with eligibility and moving all the way through to whether or not the student qualifies and then creating that IEP definitely is the way that we would breathe life into this policy and bring it to the school. Absolutely.
Okay, and just as a follow-on, then maybe comment question, kind of to similar to the Pastor Johnson's point. There are questions and people who go through the process have their own, questions and complaints about it. So what's the venue in which is there a way in which we assess like the PPT and the IEP process? Is there any way does that come through the policy committee where opportunities to improve or inform that process based on folks' kind of complaints or experiences? Is this the committee that actually would be the forum to assess that?
That's an amazing question, Mr. Walker. I believe that our curriculum teaching and learning committee would be the committee to examine the quality of the implementation of this policy and of our IEP process.
Okay. Thank you. I just asked that more general question because I don't want to be bringing issues and concerns about that process if this isn't the forum for it, because I think kind of to Pastor AJ's point, whenever you hear about people's issues around this, it's usually around that experience they have with the school and the folks and teams around that particular, those elements. So if that's more teaching and learning, then fine, we will have that to be the forum where that experience comes to bear. Thank you.
I'm going to ask Ms. Santiago to weigh in on that. Can you confirm, Ms. Santiago, that the Teaching and Learning Committee would be the correct place for our board to understand the quality of our special ed programming and the experience of families?
I would think so. We could also invite Ms. Hoffman to the Family Community Engagement Committee because as it relates to how families see it. But we can talk to them what they feel, and then we will let the board know which committee we can bring that through.
Thank you very much.
Just a following question. quickly. So did I hear Ms. Santiago said that there's an action there? So is there someone that's being invited to the FCE committee then on this
She's gonna
question?
follow up with the individual to see which committee she thinks would be best, whether
Okay.
it be teaching and learning or FCE or both of them.
And
Oh,
actually,
okay.
Mr. Walker,
Okay.
can I have you repeat what your question is just to make sure I have it correct?
I think it's, well, okay, the question was about where's the proper forum to bring, questions and issues and improvement recommendations around the IEP and the PPT process. And I only asked that question because, kind of to Pastor Johnson's point, most of the issues or concern people have about the special education experience tends to center around those, those types of interactions, right, with the school and the school staff and leadership.
So then what, I guess, as for the purposes of the committee, it would be teaching and the board and the community members what the IEP process looks like now as far as a form, and then maybe teaching what happens when a parent is not, like what the process is that they follow. Is that weird?
Right, because what I'm saying is if some parent comes to us and say, hey, this IEP process didn't work out for me, I would like it to do A, B, or C.
Okay.
Then that needs to be some forum to bring
Mhm.
that thought or idea or parent concern.
Yeah, and I believe there is, but so I would talk to Ms. Hoffman and see where she thinks is the best fit or whatever we have time, and
Okay.
and I will follow up on that.
Okay.
Yeah, I think, Mr. Walker, I appreciate you elaborating on that because I think where I wanted to know specifically was how do we, is it us in the policy committee as it pertains to the IEPs and such that we need to change something so families are more aware, more accommodated in their search for the proper, resources for their child. And the second thing kind of I was leaning toward is, if there are lawsuits, right, does our policy maybe need to change, on those issues? And what I heard was Attorney Mazurek will, and I forgot the other young lady on the line, will come back to this committee and give us a small overview of what those potential things look like, so we can navigate ourselves accordingly in our policy committee to respond to the community in a way that's reasonable. Sounds like a lot, sounds very broad, sounds very crazy, but I'm getting a lot of phone calls around IEPs and students being placed and not placed, and I just want to make sure that as chair of this committee that we're not bypassing those things, and that we're actually looking into it if it falls under our auspices. Okay, so you're all set to continue, Dr. Silver, and hello, Ms. Brody, I think that is on the line. Good to see you, good to hear from you. Good morning.
Our second policy for a first reading for, okay, I was afraid I was muted. Our second policy for a first reading is a preschool special ed program. And this also is a new policy and a mandated policy for us. And it has been edited and refined by Ms. Hoffman, our attorneys who specialize in special education, and has been shared with our team and our Board of Education. And so this policy, a brief policy, speaks to providing special education support for our preschool population. And everyone has received the policy, and I'm trying to do less reading out loud and more pausing to give people a chance to jump in, if that's okay with you, Pastor AJ. I'll just continue scrolling.
Just so that everyone knows, I did make a couple of changes early this morning, so I apologize if you had read it and now are seeing purple or red. There are just a couple changes.
Thank you, Ms. Ward.
Do you changes as I am driving into my office and can't really take a
Yeah,
peek at
absolutely. Oh, yes, I could do that if you'd like. So one of the changes is it's had reverse mainstream listed, which speaks to like having a classroom of students with special needs and having one or two models, peer models, and we don't do that any longer. That is an old practice. We actually do what we call a, sorry, you guys, I just walked up the stairs. What I would refer to as least restrictive environment, meaning we really do see our kids where they are. So we have students who are in preschool in the inclusion classrooms. We have students in the community that we go out and see. So we're really looking at where their least restrictive is. And then if that doesn't work, then we would bring them into a more of a self-contained classroom. And then, oh, go ahead. I apologize.
No, continue. I was going to say this. Thank you for that clarification, because I was thinking that, but I wanted to understand what least restrictive environment meant.
Yeah, sure. And it really does mean just what it says. Like, so, you know, mainstream is obviously the least, and then we can go up to a more restrictive of that self-contained. And then the other change that I made is the policy, or in the policy, it stated that we would, after, if a student did not qualify coming out of birth to 3 into the LEA, that we would do another screen. And we don't do that. That is actually information that is provided from birth to 3 to students who do not qualify. And what we have is at the 6-month and the 12-month period after not qualifying, we have to send a letter out saying to parents, hey, remember, you have access to this screen. If you have concerns, please fill that out. So that is something else that was changed. And that's a new law as of July 1 this year.
Thank you.
Absolutely.
Thank you very much, Ms. Ward, for summarizing these changes. And it is a brief 2-page policy, brief but powerful, mandated. And now, thank you, Ms. Ward, we can be assured that it's up to date with our statutes. And so I'd like to move to the next policy if there are no more questions.
Continue.
Thank you. Okay, moving right along. Our third policy for our first reading is exemption from instruction. And by law, we are required to provide exemptions if there is a curricular, a part of the curriculum that a family does not want their child to receive. And we would provide an alternative. And this is really done all the time. You can see that the number was changed in alignment with, was recodified. This is a policy update. There are additional areas that we have added. They include substance abuse education, any religious references, medical education, and bilingual education. We also refined that the section is a section of animals, family life, and education instruction. And again, reassurance that excusing a child from this portion of the curriculum, the child will receive an alternate learning opportunity. And so those are the updates that Dr. Legrone supported the revision of. Are there any questions about this?
No, not from me. Thank you.
No questions.
Okay, not hearing any more questions, that concludes our 4 policies for a second reading and 3 new policies for a first reading. And with your permission, Pastor AJ, we would move those 3 new policies to the board for a first reading. And also with your slide deck, you receive a calendar of upcoming policies, the ones that we've already addressed. And these are today's policies. We would bring them to the board meeting for April 19th for our first reading. They would return to our next policy committee meeting on May 2nd for a second reading. And we will also have, three new policies that we'll do a first reading on May 2nd as well. And those are alternative education programs, incarcerated youth high school credit. This is a revision that we need to make to ensure that youth who are incarcerated are able to accrue high school credit so that when they return, they are able to move forward and graduate with their peers. And also graduation requirements, there are some refinements there that need to be made. And we have a family engagement policy that Ms. Blackburn is working on right now with her team. So those would be for a first reading in May.
I have a question.
Yes, sir.
The incarcerated policy that you just mentioned, is that a state mandated policy, or is that something that we as Hartford schools do?
So that is part of a legislative change that took effect last July. And we need to have a process in place by this coming July 1 so that students, incarcerated youth, can earn high school credit. So that is a legislative change.
Okay, outstanding. Dr. Silver, do you mind either through Christina or yourself just sending me the legislative language around it? I'm interested just to take a peek at it and how it was passed through the General Assembly.
Absolutely. Absolutely. Thank you for being interested.
And as for the documents, what we're moving forward for a second reading, that will just be on our agenda, right? For our next meeting as a second read.
Yes, sir.
Okay. Does anyone have any issues with that? Moving that forward, moving the items forward?
No, I don't have any issues.
No,
Okay.
no.
All right, Sister Brody. Mrs. Brody, any issues moving it forward? I'm good. All right, perfect. Outstanding. Any other business needs to be conducted? Is there any other business that needs to be conducted?
We've met all the objectives on our planned agenda that we had.
Okay. Are there any questions from board members? Any concerns?
No, I think we've raised a few issues, and no, I'm actually supporting giving back some time. This is good.
All right. All right. Well, if all hearts and minds are clear, you all have a wonderful Monday. I pray that God give you his grace and his mercy and gives you joy and peace on this beautiful Monday. You all have an outstanding day.